Dear friends, today we will discuss on disinfection. So let us start with the definition of disinfection. Disinfection is a process which reduces the number of contaminating microorganisms, particularly those liable to cause infection, to a level which is deemed no longer harmful to health, whereas antiseptic is used to describe disinfectant applied to living tissues such as wounds. Decontamination is the general term for treatment used to make equipment safe to handle by freeing them of microbiological, chemical as well as radioactive and other contaminants. Disinfection. 6 physical agents are there. First is the heat, whereas 2 types of heat are using: dry heat, for example flaming; moist heat, where 3 ranges of temperature are there. First, temperature below than 1000 degrees Celsius, temperature at 1000 degrees Celsius, and steam at 1000 degrees Celsius. Temperature below 1000 degrees Celsius, for example vaccine bath, inspiration as well as pasteurization. High temperature short time and low temperature holding method, whereas temperature at 1000 degrees Celsius involving boiling, thermalization as well as steam at 1000 degrees Celsius. Filtration is the choice of sterilization because it is the method of removal of bacteria from heat labile liquids such as sera and antibiotic solution. Factor affecting its efficacy are initial number of microorganism, type of microorganism, and composition and pore size of the filter. Uses of filtration are separation of toxin and other soluble products of bacterial growth, sterilization of materials or other material, and purification of water. The rest of the methods are involving, for example, radiation sterilization as well as chemical method. Radiation sterilization, ultraviolet rays are used to disinfect in hospital, operating room and safety cabinets. Chemical methods. Many chemical agents are used as disinfectant and antiseptics. So now come with the properties of ideal disinfectant as well as antiseptic. It should have wide spectrum of activity, act in the presence of organic matter, high penetrating power, be stable and effective, and not be corrosive, not be toxic, as well as should be safe and cost effective, having long shelf life. There are general rules for use of disinfectants are: disinfectants are generally toxic and may damage to the irritate skin, conjunctiva and mucosa. Disposable gloves should be worn when handling them. A disinfectant may have narrow spectrum of activity against different kind of microorganisms. Each lab should have a written disinfectant policy. Disinfectant must always be used at the correct concentration, and the life of disinfectant varies with its formulation, and many disinfectant deteriorates when diluted with water. Now we will discuss on types of disinfectants. High level disinfectant, example aldehyde gases used for endoscope and surgical instrument. Intermediate level disinfectant, example alcohol iodophore, uses the laryngoscope. Low level disinfectant, for example quaternary ammonium compound, and uses electrocardiogram and stethoscope. Now come with the chemical agents. Various chemical agents are available, for example aldehyde including formaldehyde, glutaraldehyde, alcohol, ethyl alcohol, isopropanol alcohol and methyl alcohol. Bicarbonate, for example chlorhexidine. Next, discuss with the halogens. Chlorine and hypochlorite both are widely used as disinfectant, and iodine used as the skin disinfectant. Actively bactericidal but moderate action against spores. Phenol and phenolic compound are the choice of disinfectants because phenol compound like bisphenol, hexa, chlorophane has particular activity against gram-positive cocci. Surface active agent, these are substances that reduce surface tension. Anionic, cationic, non-ionic and amphoteric detergents are used generally. Blood spill general information. Universal precaution must be observed. When there is a blood spill, access to the area should be limited. Only disposable towel, tissue, paper should be used, and if a spill involves a broken glassware, glass should not be picked directly with the hands. Disinfectant, a solution of 5.25 sodium hypochlorite diluted with 1:10 and 1:100 with water. For viruses, and effective concentration are those containing 10,000 ppm for spillage and 1,000 ppm for cleaning. Freshly prepared solution of disinfectant should be available on every microbiological workbench. Surface disinfectant that are used for phenolics, hypochlorite and glyceraldehyde and ethanol. Now procedure for fumigation: seal the room for adhesive tape and edges of door and windows to prevent leakage. For each 1000 cubic feet of space, 500 ml of 40% formaldehyde solution and 1 liter water in an electric boiler with a safety cut out when boiling dry and time switches. Next, switch on a boiler, leave the room filled with formaldehyde and seal for 24 hours. Then open the door and enter the room with respiratory protective wearing. Disinfection of skin involves laboratory staff must wash hands thoroughly after their work. Washing with soap and water remove most of the transient surface contamination, and a small cut of abrasion should be treated with soap. Broken skin and wounds should be cleaned and irrigated with mild disinfectants. If the unbroken skin is grossly contaminated with bacteria or viral pathogen, it should be rinsed with phenolic or hypochlorite disinfectant. There are methods for the testing of disinfectant. First is the Ridley-Walker test and second is the Chick-Martin test. Here this slide you can see the method of that, and methods are used for testing of disinfectants. Testing of disinfectant continue in use test used to monitor performance of particular disinfectant and how it is being used. Sample of disinfectant solution in use around the hospital are tested, and it determines the survival and multiplication of contaminating pathogen in disinfectant solution. Policy should consider the following: the source for which the process is required, the process and products available for disinfectant, and the categories of process required for each item, the specific product and method to be used. So dear friends, this is all about the disinfection. If you are having any query and doubts, you are free to ask anytime. Thank you for your listening and your patience.